I will call the meeting to order. We will start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the regular trustee meeting on May 16, 2017. Minutes of the monthly finance meeting on May 16, 2017. And a check report May 8, 2017 through June 7, 2017.
I move we approve the consent agenda as presented.
Second.
I have a motion by Dr. Brown, a second by Dr. Hannaford to approve the consent agenda as it was presented. Roll call vote, please.
Gaspard?
Yes.
Hannaford?
Yes.
Kinsey?
Yes.
Sanderson?
Yes.
Simon?
Yes.
Brown?
Yes.
All right. Next item is the CEO's report. Candace.
All right, as you can see, we hired, about 12 new staff members during that time period. Meditech, the 6.08 upgrade will go live August the 8th. Meetings attended, Dr. Rader, Kyle Mondorf, Bridget Cosby, and Val Jepson came out from St. Anthony's on May 31st to get some feedback on the affiliation agreement and how things were going. And we had several other providers in attendance and was able to get some feedback and some things that we can work on. So we appreciate you guys coming out and doing that for us. For the month of May, we had 6 swing bed admissions with an average stay of 5.33 midnights. Quality, you can see that attached in your packet. We've got the HCAP scores here. I was just flipping through them and I would encourage you to do so. This gives us an opportunity. There's comments that patients offer, and we look through these to see where we have opportunities for improvement, and obviously there are always opportunities for improvement, but this one caught my eye that I wanted to point out. This was from an inpatient survey. I had been told negative things about Shore Medical Center, but everyone who dealt with me had great attitudes and their performance was outstanding. So that's why we look for through those things to give kudos, pats on the back, as well as to see what we can do better. So it's good information. Ashley has to keep her education for CEUs to keep up to date, and she attended a course at the University of Oklahoma for social work. Dr. Mullins actually had 2 clinics in May because she's not going to have one. She's going to be on vacation in July. We have gotten 2 new RNs, Holly Hoffman and Crystal Elliott, full-time positions, and that was much needed. Registration, yay! One of my favorites is coming back. Every time I see her in town, I would say, please, are you ready? And guess what? She showed up at the door. Melanie Cunningham's coming back to work for Heather in the front lobby. Melanie's a great smiling face, and I think she'll be a good face for us. Heather's been working hard on the Charge Master, made over 700 Charge Master edits. The Charge Master is what drives our charges and clean claims. So she's been working on that. We worked with Northwestern and Northwest Technology Center for MASH Camp again this year. We had 44 students for MASH Camp, and we hosted MASH Camp 2, which is the career shadowing. We had students in radiology, PT, nursing, lab, and the physician's clinic. And we had, did I say we had 6 for that? That went well. I thought that the students were engaged, and it seemed to be, I think it can grow and work off of that every year. We're targeting kids to get them thinking about careers in healthcare because these are kids that are raised in Northwest Oklahoma that hopefully we can get back. And so thank you guys for doing that. They work really hard to accomplish, to pull that off. Thank you. We continue to explore the UPL program. Kevin and Bo will say a little bit more about that. Sad to report that Lindsay Head is leaving us. Her last day is the end of June. Her and her husband are moving back closer to their family. He got a job back there, and so is Lindsay. And so we wish them well, and I will be interviewing for that position soon. One little gal actually that used to work for us is in PA school right now, and so we'll be talking with her, and then have actually talked to another nurse practitioner that could be interested in coming as well. So we'll take all we can get, right? That's all I have. If you guys have any questions for me. All right.
All right, there are no questions. I would entertain a motion to approve or disapprove, I guess, the CEO's report.
I move we approve the CEO's report as presented.
Second.
I have a motion by Darlene Sanderson, a second by Dr. Hannaford, to approve the Share Medical Center written report for June 20th, 2017. Roll call vote, please.
Hannaford,
Yes.
Kinsey,
Yes.
Sanderson,
Yes.
Simon,
Yes.
Brown,
Yes.
Gaspard.
Yes. All right, thank you, Candace. Next is the CFO's report. Kevin?
Okay. For the month of May, I can report that all three facilities did make money, and we'll kind of go through this report. First off, the operating cash balance at the end of May was $468,519, and that represented 13.4 days of operating expense. The hospital's accounts receivable balance was $2,900,273. It increased $4,406 during the month of May. Gross days in the AR was 53.6 compared to 49.2 in April. And our net days were at 36.6 in May compared to 35.7 in April. Our accounts payable balance for May was $673,845. This represented 43.4 days of operating expenses. Our gross patient revenue for the month from all three facilities totaled $2,011,759. That was a $147,840 increase compared to the prior month. The hospital had the largest increase in revenue. They increased by $124,941. Their nursing home increased by $5,880, and the homestead increased by $17,022. Total patient days for May were 124 compared to 135 in April. Total clinic office visits for May were 1,390 compared to 1,358 in April. And the average daily census for the nursing home in May was 53.5 compared to 53.6 in April. Hospital contractuals for the month of May was 57.9% of gross patient revenue. Accounts written off to flight agency was $4,967. Charity care for the month of May totaled $14,253. So we had net income from all operations of $214,412, and net income after sales tax and other items of $281,244. Like I said, all three facilities made money. If we quickly turn over to page 5, the hospital actually made $223,338 after sales tax. But a large portion of that was due to that we got payment for the EHR money. That's a little over $400,000. So without the EHR money, we would have had a loss for last month. But with that, we was able to make a profit. Otherwise, the expenses were pretty much consistent from month to month. The only other item was contraction was up a little bit compared to the prior month. Turn over to page 8. The nursing home continues to make money. They made $34,345 for the month. Compared year to year, they're at $198,825 net profit this year compared to $192,766 loss last year. Page 9 is the homestead. The revenue was up, like we said, net income for the month was $30,633. Page 11 is your, or page 10B is our statement of cash flow. The reason that you see the cash flow from finance activity went from $54,660 to $258,090 is we had a line of credit that we paid off the HR money, and so that's the reason we had a little over $200,000 we had to pay back to the bank. So we've got all our line of credit and everything paid off, so that's the reason. So that's a good thing, and we still actually seen cash improve for the month. Page 11 is the accounts receivable. Another good indicator was we was able to move our unbilled from April from $556,000 down to $378,078. So we were able to get bills out as well, so that also helps the cash position. Page 13 and 14 is your balance sheet. Looking through the statistical graphs, last month we were very slow on the outpatient volume. That all came back as you can see the increase in revenue, and you can see through the graphs for those areas where we've increased. So, any questions on, once you look at that, any questions I can answer? If not, if you'll flip over a few pages, past some of the statistical sheets, the first sheet should look like an Excel sheet, kind of looks like this. It'll say capital budget. It's time for us. We have to do this every year. We have to do a capital and operational budget approval. The first thing I would say is the capital budget. We have to do a 3-year plan, because everybody's found that page before. Every department kind of gave me a list of the items that they would like for us to look at and purchase in the upcoming next 3 years. And the reason the A, B, and C list is items that they think A means it's critical to the missions, B means it'd be nice, and C means it's just kind of a wish list. And then they go ahead and project out for 2 years. You can see what each area likes at the very bottom. I've got the total for all of it together, but I broke out between what the nursing home would like to buy as far as capital items and the hospital totals. So as you can see, we both have big lists. The hospital has 2 large items. When we take those out, the rest of the wish list is not too much. Take out the digital mammography, which we're going to talk about a little bit later. And we need to really start looking at updating our servers and software, either with what we have or going outside and do a different thing. Take those out, you're taking $932,000, about down to about $62,000. So those are 2 big ticket items. Nursing home has several items that they need, so, and we'll be probably looking at them more this year. We've really focused on the hospital in the last few years. So that's the capital budget. Is there any questions, any items that you see on there that you wonder what they are? If not, we can look at the budgets for all 3 entities and the combined budget. Just so you know, I've kind of listed out what the budget assumptions were. The one thing is we're going to increase the hospital's revenue price structure by 3%, going effective July 1st for everything except for our clinics and our room charge. But everything else is going to have a 3% increase. That's something that normally happens at the first of the year, so we added that in there. We also going to have an increase in some other operating revenues due to hopefully the UPL program will go through and some of the agreements that we're working on as far as that goes. And we also see some increases though to our operating expense as well, because we're going to have some outlay for the increased revenue to make sure we oversee that. And then we had some decreases in some operating expenses due to elimination of contract labor and some position recruitment expenses, because last year we had, recruited a position, and this year we're not do a recruitment. So if you flip over to the very first page is the combined profit and loss for all 3 entities. So next year, if everything goes as planned, we should have a net income from all 3 entities of $523,092. The next page is the hospital by itself. The hospital would have a profit of $4,641. The nursing home, $311,979, and the homestead, $206,472. Went into quite a bit of detail at finance, but I will answer any questions, general questions if you want to here, so.
Kevin, correct me if I'm wrong, but last year, not the current year that we're in, our EHR reimbursement was larger than what it was this year, right?
Right.
And next year's will be
It'll
less.
half again, right.
So technically, just looking at everything, even though when you look at where we are year to date, while year to date shows that we're behind where we were last year, probably from a profit loss standpoint, without EHR money, we're actually ahead.
Yeah, we
correct?
are, correct, yes,
Okay, and we had less sales tax dollars on top of that.
correct.
And so my point in that is all three facilities had better years than what they did the previous year. And so kudos to each one of you guys for what you did, the changes that you made, the revenues that you did. So good job. Appreciate that. And as we move into next year, while there are additional revenue streams, there are also, in this, you're taking into consideration the sales tax isn't increasing, it's staying the same.
Right.
It will be less of an EHR,
Right.
but we are hoping possibly then UPL will kick out at some point.
Yeah, yes.
Okay. And I know our cash situation improved. As you look at that, I mean, depreciation, while it's on there, that's over $1 million. That's a non-cash item. So. Is there any questions in regards to the budget? Either budget?
So if we approve the capital budget, I mean, is that,
All
Will
you're
you
doing is,
get-
what that means is that you're just approving it, that you accept that I've got those items. Each of those items will still have to be brought to you if they're over $25,000.
Okay.
Yeah.
Yeah, it doesn't mean that.
You're
you just-
approving the goal.
automatically?
Yeah, that is
Yeah.
something we'll have to buy. It's just that I have to give you a listing of the next 2 years of what we could possibly have to purchase. And there might be some items that's not on there that could come out of it.
Are there any other questions? If not, I would entertain a motion on the 2017-2018 operating budget.
Make a motion to approve the 2017-18 operating budget?
Second.
Dr. Brown's closer. I have a motion by Dr. Hannaford, a second by Dr. Brown, to approve the 2017-2018 operating budget. Roll call vote, please.
Kinsey,
Yes.
Sanderson,
Yes.
Simon,
Yes.
Brown,
Yes.
Gaspard,
Yes.
Hannaford.
Yes.
Okay, next, I would entertain a motion to approve or disapprove the 17-18 capital budget.
Make a motion to approve the 2017-18 capital budget.
Second.
There you go. I have a motion by Dr. Hannaford, second by Hayla Simon, to approve the 2017-18 capital budget. Roll call vote, please.
Sanderson,
Yes.
Simon.
Yes.
Brown,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey.
Yes.
Okay. The next item is discussion and approval or disapproval of the purchase of the mammography equipment.
Okay. I don't know, I think almost all of you know that we have not been using our mammography unit for the last couple of months. We've had an issue that the images weren't as good as we'd like to, so we had the radiology director go out and look for some equipment for us. After talking with the finance committee today, we decided we got a quote from GE. It's a refurbished unit, and it comes with a year's worth of warranty. And what I'd like to propose is that we purchase a mammography unit from GE for $125,149.48. Anyway, that is, we feel would be adequate. This machine is 2D now, but it has capability later on. If we decide to ever go to 3D, we can just add it on without having to get a new machine. So that's also, there's a little bit of flexibility moving into the future if that's the direction we decide to go, so.
Yeah, and it comes with that,
A year's warranty, yes.
a year
I did.
warranty already.
Yes,
And the way we discussed it is that was gonna be another $150-some thousand for the warranty over what is projected to be the lifehood of it. And in 3 years, 4 years, it quits. It's cheaper to go buy a whole new one than it is to pay that additional warranty over that period of time. So,
So this is the only quote we have?
no, we had several
How
quotes.
much is a new one?
The
How
new
much
one,
is
just like this, is
someone
starting
else?
$300,000. The same one that's new, this is a refurbished one.
And what's the warranty on a new one?
It's a year and you have to buy maintenance. It's just that it's.
Still a year?
It's still a year. This is just, is a refurbished one, so it's been used. But they go through it, GE goes through it, inspects it, and brings it all back up to specs. But, you know, it's just to use piece of equipment, I guess, all is new. But yeah, the same piece of equipment costs $300,000.
Can you do an estimate how many mammograms we, I mean,
The last couple of years, we've done 340 mammographies. What I project the break-even point is we need to get to 530, which is 47 a month, which we think we can do. We do right now about almost 30 a month, so.
that was with the warranty though, wasn't it?
Yeah, that's with the warranty, yeah, so it won't be quite that, you're right,
Right.
so it won't be quite that much.
What we talked about in finance is if we had a 20% increase, that would take you up to over $200-some thousand in that period of time. And hopefully the providers would be, with a newer, better machine, would be using it more.
And this is what, the person who will be running this,
Yeah.
this is the one they favor.
Correct,
You guys have questions or concerns about that?
You know how old the old one was?
Oh, hold on.
Yes,
What year did you come, Kelly?
I came in 6, it would have been in 8, 7 or 8.
Yeah.
It's about 10
And
years.
it was with a major contribution.
Right.
And what's the lifespan of a machine usually?
That,
I mean, is that pretty
that
standard?
one lasted us about 10 years.
Technology just changes so much. It's hard.
So the upgrade would be, if most people are going to a 3D, is that?
Yeah, that's what would be the next step up for that. And it has capability, we're just not gonna purchase it right now, we don't need to.
Right now, 3D is not standard.
Right.
Not everybody goes for 3D now, but if it does become that, then yeah, we can upgrade.
It's
to that.
capable.
And not all insurances will pay for a 3D right now. Some of them will.
Any other questions? If not, I would entertain I'd entertain a motion on the purchase of the mammography equipment.
I would move that we purchase the mammography equipment without the extended warranty.
Can you say from GE and for the amount?
Okay.
Yes.
From GE, what is it?
125, 149, 48.
Okay. Right here. Okay, 25149.48.
A second.
We have a motion by Dr. Brown, a second by Darlene Sanderson to purchase the mammography equipment from GE for an amount of $125,149.48. I was just looking to see if there was a... Rick, is that good enough, or do we need like a model number?
No, that's fine.
Okay. Okay, roll call vote, please.
Simon?
Yes.
Brown?
Yes.
Casper?
Yes.
Hannaford?
Yes.
Kinsey?
Yes.
Sanderson?
Yes.
Do you have a delivery date?
Probably 6 to 8 weeks. Once I make the order, they'll tell me to file it every day.
And it might be the time to point out that we still are having the mammography done, but it's done, scheduled by once a month visit.
Okay. Good point.
Yeah. All right, Kevin, anything else?
Nothing, no.
All right. Thank you. Next, Medical Staff Executive Committee, Dr. Kinsey.
All right, so the medical staff met on June 8th. Dr. Self and I were there, along with several of our ancillary staff. We had a discussion about the EHR and meaningful use. We reviewed the cooperative report. There were no people to credential this month. And there's some other things that I'm going to talk about in a moment. But that was pretty much the minutes of the medical staff executive committee. As I said, credentialing committee had no recommendations this cycle. For QAPI, the main event was the fact that we got the remote thermometers in place, and those are being read at the nurses station. So if there's an alarm, it goes off at the nurses station, so we know right away if our refrigerators are out of compliance. And Kevin said we know they work because the alarms have gone off. Yes, they have. Just momentarily though, no major problems. So that's all good. For improvement to patient care, we reviewed the review of contracts. Then we had two policies that we need to talk about. The first one is the surgery policies and procedures, and there were no changes to surgery policies and procedures. And the medical staff recommended that we approve that. So I move that we approve the surgery policies and procedures for the year.
Second.
We have a motion by Dr. Kinsey, a second by Dr. Hannaford to approve the surgery policies and procedures. Roll call vote, please.
Brown?
Yes.
Casper?
Yes.
Hannaford?
Yes.
Kinsey?
Yes.
Sanderson?
Yes.
Simon?
Yes.
The next thing was the approval of the central sterile policies and procedures, and there were some technical changes to the central sterile policies and procedures, but they weren't major, they were just requirements, and so it was brought up to date on that. So I move that we approve the central sterile policies and procedures.
A second.
We have a motion by Dr. Kinsey, a second by Darlene Sanderson to approve the central sterile policies and procedures. Excuse me, roll call vote, please.
Casper?
Yes.
Hannaford?
Yes.
Kinsey?
Yes.
Sanderson?
Yes.
Simon?
Yes.
Brown?
Yes.
Okay. Anything else, Dr. Kinsey?
That's it.
All right, thank you very much. Next is the shared convalescent home report. Rita?
Already?
You know,
Already?
Can I interrupt because there
Yes.
was one more thing?
Yes.
We actually held elections also.
Okay.
Yeah.
We should probably mention that. I'm going to continue as chief of staff, and Dr. South is going to continue as vice chief.
Okay, very good.
You nominated, you approved, you nominated.
Okay, so in May, of course, the hospital had Healthcare Week, which included all of the facilities. But the nursing home also has their National Nursing Home Week. And we had hot dogs and hamburgers. We were unable to do it outside. And then the weather was not conducive to that. And then it wasn't too long after that, we had to practice our Code Black, which I have to say, I've been here a long time, it's never been that close, never been that scary, ever, ever. We stayed, the residents were in the halls, the staff did an excellent job for the first round. The third round was a surprise, and I don't know how they did it, but they got them all back out. And Kevin, we talked on the phone a lot, went outside, actually seen the tornado over there. It's pretty scary, pretty scary. Anyway, the staff did an excellent job. The residents were quiet and very calm, so we were happy for that.
What's going on?
I know. Well, you know, some of them don't want to leave their room. Anyway, in May, our census was stable to 53. I think, I'm not sure, but June looks close to 58 or 59, possibly. We've been really busy the last 3 weeks. We've held our skilled usually at an average, today we have 7, we probably had an average of 5 per day. We're still trying to use less and less agency staff, and I think we did that in May very well. We do have a lot of new CNAs, some are in school, some will be coming out, and we're orientating those, so that does make our costs go up a little bit. But I think they're going to stay. The nursing students just flooded in, the ones that are going into their freshman year and they're planning to go into nursing school. They flooded in the last part of May and the first part of June, so we're reaping the benefits of that. We are still in desperate need for licensed nurses, so if anybody can send them our way. I'm working on a couple. I'm not going to tell you where from, but we'll hope. Even if I get them part-time, I don't care. A shift a month, you know, it doesn't matter. Housekeeping, we're having a couple of changes there due to just drive time. Some employees feel like it's summer, their kids are home, so we'll have some changes there. They're staying busy. Dietary, I believe, has a couple of positions, and due to our Code Black, we looked at our procedures, and you know, there was a couple of things we could have done better, so we're going to look at those and update those a little bit. I think everything else, Tanya's poor list of all the telephone numbers, I can't tell you what it looked like at the end, because I carried it with me trying to figure out who I needed to call, but we'll do some changes there and we'll bring it. Other than that, I really want to thank the staff. They've worked hard, and I also want to thank the board, especially Jason and Kevin and Candace, for their support. And we would have not probably been able to do as good without your help and support. Thank you.
Very
Thanks
good.
for
Thank
hanging
you.
in there.
Yeah.
Well, when I'm upside down, you have to put me back up.
Or make a cake.
Maybe.
All right, thank you.
Mhm.
Next is the homestead report. Kelly?
Well, in May, we had pretty good increase in occupancy. We jumped up to about 78%. In June, we'll be over 80%. So by the time we finish the month, but I expect that July we'll see a decline. We've got some folks that are having health issues and may not be able to return to the homestead. So I expect we'll see some rental agreements terminate. Hopefully we get some people to come in and have new rental agreements take their place. But even so, we have a couple of, one contract lab tech, I believe, staying with us right now that his term at the hospital will be through the middle or first or second week of July. So some of that revenue will also stop. So we'll see how occupancy goes, but we've had a good month in May, another good month in June, and we're still financially doing real well. The highlights since our last board meeting, we've had we've started our Tai Chi program again. That's been really popular. It's provided through a grant with the Oklahoma Healthy Aging Initiative, or that is the grant program through OU Health Sciences Center. They send out an instructor, and so we have Tai Chi. It actually has grown to 2 classes a day instead of 1. It is open to the public, and so we've been able to get folks from town to come out and participate in the Tai Chi exercise program along with our residents. And that's going real well. They were out again today, and it's twice a week. And we're also 1 day a week when they come out to do the Tai Chi, they're doing diabetes education class. So, and that's been not as well attended as the Tai Chi, but it is the first time they've offered that at our facility, and I expect if they do it again, it'll be better attended, as just like Tai Chi has been. The Father's Day game day that we had, I barbecued about 80 chicken leg thigh quarters in the 102-degree heat. It was awesome. And we served about 75 or 80 residents and guests for that. Had games all afternoon. Everybody just had a wonderful time. We had some family members and friends that really, actively engaged in facilitating, what we were doing, and it turned out to be just a really great activity for our residents. And the staff really enjoyed it too. We recently were, if you'll recall, 2 or 3 years ago, we put the new floor into the lobby in the cafe, and right there around the first floor entrance, around the fireplace in that area. It has failed according to its standard for how long it's supposed to last and all of that, and the manufacturer is going to replace that. So we've picked out a different product this time, hoping to have a better result, and it will be a considerable inconvenience when they go to put that down again, though. So, but it's supposed to have a 15-year commercial warranty, and it was really getting pretty scratched up after only 2 or 3 years. So it's good that that's being replaced. We've also completed, as of today, our implementation of or our transition into cable for data and cable for phone systems. Chickasaw was out today and did that, as well as Pioneer was out to do the final conversion of our surveillance system into our cable network. And so we're fully transitioned. We'll look forward to saving quite a bit of money per month on our total cable, phone, internet bills moving forward. So, and everything's so much faster, internet-wise. The residents are going to be so happy. I'm happy too. But, think that's, we are still recruiting for one position in the cafe, a server position, so. I'm happy to answer any questions anybody has.
Have you personally tried the Tai Chi?
You know, I'm not with this group. I used to teach Tai Chi when I was a therapist.
Really? Wow. Impressive.
There you go.
I could not do it today.
Actually, by Kelly.
You know, I can greet the morning sun and pet the peacock, and that's all I remember.
All right, thank you. Do you have anything to report from the foundation?
I do not.
Okay. We will skip on then to St. Anthony's report. Bridget.
Okay. As Candace mentioned, we did have the Saints First site visit where we had visited numerous of our hospitals. I appreciate gathering everybody together and more so feeding us so that we could have an actual meal that day. And it's kind of brutal when we try to get to 6 hospitals in one day. So they were really excited about going through the drive-thru again. And Candace was very nice and served us some food, so that was great. But we did get some good feedback from everyone that was in the room, so we appreciated that. We will have some follow-up with Ashley to work on the 2 midnight rule and some UR engagement, maybe enhancement for utilization review. The ever-changing world of commercial inpatient payers and billing and collecting of all of that is complicated. And we do so much of it up there that it certainly is easy for us to expend that knowledge down to this level. So we'll be happy to do that. I'm just working, Val's schedule is very busy, so I'm working to lock her down, but we'll get her out here for follow-up on that. One of the things that Kyle mentioned during that meeting, which I wasn't aware of until a couple of weeks before that, or would share with you before, that we are working on putting a NICU in place. I know that that's probably, for this facility doesn't mean a whole lot, but it does give the ability for OU to transfer some of their lesser NICU patients over to us. It's in conjunction with OU anyway. It's the same physicians that are monitoring the program. So we're hoping that with us opening some beds, it'll open some opportunities with OU so we can share, in helping the state open up some additional NICU beds. So we're excited about that. We don't have an exact start date yet. As you well know, we have to wait on the State Department of Health and all those great things that have to be done. But it was nice by the time that we got out and did the St. First visits that our capacity issues have lessened. I think in the month of April, we accepted 50% more patients than we had in January because we're just really strapped with capacity issues in December, January, and February. So along with us opening additional beds and working on some length of stay issues, it looks like we're kind of, the proof will be in the pudding when we roll back up into if we have another flu season or something. But definitely the relief is there, and so I have not seen that we have had any diverts for any other reason other than maybe not having a specialist available in that particular area. So I was glad that by the time we kind of hit the road that we were to that point. And then you should be doing stroke training soon. Hopefully they've been in touch with the facility. That's something that we offer on an annual basis. The physicians are also invited to attend, anybody that wants to in the facility, just to get up to date on what the newest and greatest in stroke training, go over our protocols. So other than that, I don't think I have anything else unless there's something I'm leaving out. Okay. Anybody has any questions? Rumors? Anything in the affiliate network? Those are always great to hear because you just never know what they're going to be. I think I mentioned last time that Sayer is trying to reopen their hospital. So I think their tentative date is July 10th, I think, is the date that he gave us the other day. We did put a transfer relationship together for them so that they have a place to transfer their patients, and we told them that we'll just kind of go step by step and see. It's very hard to reopen a hospital and be successful, so we certainly want to be there and support, but we also want to be a little cautious too, to kind of see how things are going to move along with them. So, they're letting them open the hospital without a survey, which is concerning. So once they get past the survey process and stuff, I think everybody will feel more comfortable about that, because there hasn't been a hospital reopened in the state for a while, so it'll be interesting, and kudos to them if they get up and going and get everything passed and certified. It'd be great. So it'd be great for that community too.
Well,
Yeah. So,
quite an undertaking.
yes.
Any questions for Bridget? If not, thank you, Bridget.
Thank you.
Next, City Council's report.
Lengthy meeting last night, couple of highlights just before the UPL. Did have our audit, approval of our audit for FY16. Approved an new investment policy. We had probably 8 to 10 appointments or reappointments to different boards and commissions. After executive session, we approved our labor contract for our fire department. And then with the UPL, we did approve our business manager to begin negotiating, getting contracts ready, our financing ready to for nursing homes in the UPL. Appreciate Candace and Kevin being available to us, and I think overall the city council is excited about the opportunities that this can provide for the city now, and also still share in our nursing homes. So, and that was unanimous. Other than that, those are kind of major highlights.
And that is a big deal that the city is taking that on, not only to help us, but also Beatles. And the city will be able to benefit, but without their help, it wouldn't happen, so.
And I don't know if everybody knows, but kind of what the city will contract with Share to basically do what we were going to do anyways, which provide that feedback and try to help the nursing homes. So that's still be a good partnership.
It will be. It may be one of those things that could only happen in Alva, so. All right, anything else? Any questions for Bo? Okay, if not, next month, I know there's several that maybe are gonna be gone. That is July 18th. Is anybody gonna be gone? July 18th?
Kelly and Jason.
Yes.
That's fine, I have to get ready for all that.
Kevin's willing to move it.
I have a lot to get ready for that extra week of practice.
I think it is.
Okay, but everybody else will be here? Just wanna make sure we're gonna have a quorum. All right, very good. If Kevin, it gets down to it, you need it moved, you let us know. You'll tough it out.
I'll turn it out.
Okay. All right, there were no items of new business, so we are adjourned.